Okay, so this is the second part of your CBC orientation. What we're going to be discussing is what your day is actually going to be like when you show up for your CBC exam. So when you do show up, I encourage you to be there about 20 to 30 minutes early. You don't need to be there extremely early because you aren't actually able to set up your cubicle. Once you get there, hopefully your patient has already been confirmed. I do encourage that you call the day before using a Loma phone to make sure that your patient is aware that their appointment is scheduled the next day. You will go ahead and pick up your packet. This will be at Jeanette's desk. This is obviously all of your paperwork that we've already gone through in the previous video. When your patient shows up, you're going to go outside, you're going to bring them back in, and you're going to stop at the little closet on your right-hand side in the clinic. There's going to be a scribe there, and they are going to timestamp you in. This is going to be the start of your first hour. You're then going to take your patient back to your chair in your cubicle, have them sit in your clinician chair while you wipe down the entire chair. Once you're finished wiping down the chair, you're going to have your patient sit down. You're going to review their health history, complete their vitals, make sure they're within a treating range, and then you're going to complete your EO-IO form. Your EO-IO form needs to be completed, again, reviewing the fact that within normal limits or denoting what you are actually seeing is what is to be written in the boxes. Do not write something in and then additionally write W and L right next to it. It's one or the other. Complete your EO-IO form. Once you're done with that, you're going to go ahead and call over a faculty to watch your anesthesia as long as you do not have your anesthesia letter. If you have your anesthesia letter, you can go ahead and move forward with your anesthesia without being directly watched by faculty. Once you are completed with your anesthesia, you're going to move forward into completing your your probing depths as well as your recession. With your recession, I have to reiterate that you either are going to write down a 0 or the recession number depending on what you're seeing. Do not leave the box blank because that indicates to the faculty when they're grading that you didn't review the recession for that tooth. So please make sure you write something in that box, whether it be a 0 or a number. When you're done with your recession, you can go ahead and move on to checking your calculus. You want to confirm that the calculus that is on your grade sheet is still there. You do not want to show up and have the calculus you suspected was there to no longer be there, which would disqualify your patient. When you're completed with that, you're going to transfer everything over onto your documentation sheets. So, again, your purple form, this is where you're going to write anything in their health history, and then the anesthesia that you used, and this is where you're going to denote the calculus that you are finding. You potentially will get points docked from your health history and your anesthesia if you do not document that properly, but you will not have any points deducted from the calculus not being correct, either because you under or overestimated it. Next, you're going to go ahead and complete your white form, your triplicate form. Again, remember, do not write anything on top of this form. You're going to write in your probing depths and your recession, and then you're going to write in your option 1 or option 2. Option 1 should be the most conservative option, so this would be 1 quadrant. If that doesn't qualify, then we're going to move on to option 2. That would be a little bit more work for you. So it's going to be a quad plus a couple teeth or potentially even 2 quads. So the hope is that your option 1 will be accepted because again, that's going to be the least amount of work for you. And then you're going to go ahead and complete your EO-IO form, writing in anything that needs to be written in as far as what your findings are. I really do emphasize that for these 3 documents, these 3 papers, you write all of this information on your deck sheet before you write it on this paperwork. This paperwork needs to stay clean. There can be no cross-contamination on it. So if you're writing down your finding as you're going through the mouth, write it down on your deck paper or on your dry erase boards, and then that way you can transfer it over to your clean paperwork at the end of your hour appointment. I do recommend that you save about 5 to 10 minutes at the end of that hour to do your documentation. Any time that you go over that hour, that's going to be points deducted from you. So it's really important to make sure that all of this is completed within that 1 hour time frame. Okay, now when you're done with your hour, you feel like you've completed, the patient's numb, you've properly documented everything, you've double checked your probing depths, your recession, all of that is good. You've made sure that your name is not located on any of your paperwork, but instead your box number, the date, and the chart number of the patient. You're pretty much ready to go at this point to submit your patient for evaluation. However, before this, we want to make sure that they have a clean bib on. If they don't, please replace the bib. And then if you need to clean off your mirror, your probe, your explorer, anything like that, if there's a lot of blood or plaque on it, please make sure that you clean those off, place them into the sterilization bag that is provided with your packet, and then place that on top of your cassettes. It's important because this indicates to the faculty when they walk up that those are the instruments they're going to use when they assess your patient. We don't want you using one probe, your faculty using another probe, and then there's some level of discretion there. Discrepancy. So let's go ahead, when we're done with completing all of that, you're going to take all of your documentation, go back to the closet where the scribe will be, hand them your documentation, they will clock you out. You have now completed your first hour. Once you have completed that first hour, you're going to go out into the waiting room, and your scribe is going to go and let a faculty know that you're ready to be checked in. You are going to have one faculty check you in for your first hour. They are going to make sure that your probing depths are accurate, your recession is accurate, your calculus is accurate, so where you found the calculus, that's correct, and that your EO-IO is accurate. If they find any discrepancies here, they're going to denote those, and you potentially will lose points. With your probing and your recession, if they find an error greater than 1 millimeter, we need a second faculty to come in and check that. So what I want you to understand is really only one faculty is checking all of your probing depths and recession, and we are only getting a second faculty in there if we need to confirm, let's say you put a 3 and your faculty put a 5, it's greater than 1 millimeter. In order to confirm that, we'll have another faculty come in and double check that probing depth. And then if they find that that is, it is in fact a 5 millimeter pocket, you'll lose points for that. But if it's within 1 millimeter, you're not going to lose points. And if it's greater than 1 millimeter, but it's not concurred, you will also not lose points. Okay? After that, once you've been checked in, or I should say your patient has been checked in, the scribe will come back out and get you. They'll let you know that either option 1 or 2 has been selected. So remember, with your white paper, you're going to either you're going to denote option 1 and option 2, and the faculty will determine which one of those they feel is better suits the exam. Once that's completed, your scribe will come back out, they'll bring you in, let you know which option you're going to scale on, and then you will sit down, or I should say before you sit down, you're going to go ahead and set up your Cavitron, and then once you've set up your Cavitron, you're going to sit down and get started with your scaling. Now that little break where you're sitting in the waiting room is a great time for your patient to go to the restroom if they need to. However, if the patient does need to get up, they get a phone call, something like that happens that is patient-based, please let your faculty know, because that time is not going to be counted against you, okay? You're going to complete your scale, and then at the end, we're going to, if you have any kind of friable tissue, if there's anything like that, please let your faculty know. They'll come in and watch you do your soft tissue curettage if it needs to be done. And then after that, you can go ahead, let your scribe know that you would like to be checked out, and at that point, they will timestamp you out and you will go back into the waiting room. Once you've gone back into the waiting room, you're going to have 2 faculty that come and check you. They're going to be looking for residual calculus, that's sub and supra. They're going to be looking for any tissue trauma that you may have caused. And then once that's completed, you're going to go ahead and kind of be brought back in to be updated on what happens, or what the results of your exam are. Now, the one thing I do want to reiterate again is before you leave for that second hour to clock out, please make sure again that you replace the bib if it needs to be replaced, and that you clean your assessment tools and put them back into the sterilization pouch. Okay? that way, again, when your faculty comes up and they sit down, they're using the same instruments that you were using, so it increases the calibration and decreases the likelihood that the reason you're being marked down is potentially because of discrepancy with the instruments used. So again, you'll go ahead and leave, and you'll wait for your two faculty to evaluate you. When the scribe comes to get you, to bring you back into the room, they're going to bring this little tissue sheet with them. The tissue trauma sheet, or notes, is going to be what the faculty found as they were going through and assessing your work. Just because there is a site listed on this sheet does not mean that it is concurred. What that means is, don't panic if you get this back and you have 2 spots located on here. That doesn't mean that you've just lost 10 points. All it means is that at least one faculty found a site that they want you to go back and look at. Okay? So you're going to go ahead, sit back down with your patient. Once you sit back down with your patient, you'll go ahead and look at those areas of tissue trauma. Make sure that you thoroughly rinse your patient out. Give them the post-op instructions. Make sure that you verbally go over this with them. And then at that point, you're going to go ahead and dismiss your patient. Okay? When you dismiss your patient, you want to reschedule a post-CBC with them if you were not instructed to do so. If you finish early and you maybe miss very little calculus, you may be requested by your faculty to complete your post-CBC immediately following your CBC exam. Generally, we have you reschedule, but there is the odd time that the faculty will look at the clock and say, you know what, realistically, with how much was left over, you can just complete your CBC at this point, or your post-CBC at this point. That's great because it gets it out of the way. However, most of the time we do need to reschedule to complete the post-CBC, so please make sure that you get that scheduled with Jeanette before you leave. The risk of having your patient leave without setting up the post-CBC is that you potentially lose that patient. The patient ends up not responding or something happens and they don't have that appointment to tie them down. So it's really good to get them to commit to getting or to setting that appointment so that we know we can feel confident that they will return and have you or allow you to complete your post-CBC. It's important to recognize that you cannot complete your CBC, you cannot move on and try for another CBC until you have completed your post-CBC. So that has to be done as a set. Once that's done, you can move on at that point. Okay, so that's kind of your whole experience with your CBC. That's what you can kind of expect when you come in. There's a few little key things that I want you to kind of be aware of just so you feel more comfortable with the exam and you're less likely to make an error. The first thing is, on your purple sheet, please make sure that you write epinephrine 1 to 100,000. That's a key issue. A lot of people lose points on that. I don't want any of you to lose points on that, so please make sure that you are really thorough with filling out your paperwork and don't have any errors on that, okay? So be very thorough with your anesthesia. The second thing is just that. Make sure you give your anesthesia before you probe. Why? Because you have to give your anesthesia in that first hour. And if you do your probing before the patient is anesthetized, and then we administer the anesthesia, and then the faculty come in and check your perio charting, they're checking it after the anesthesia. So they're going to be able to apply more pressure, get to those deeper pockets that you may not have been able to because your patient was sensitive. So make sure that you administer your anesthesia, then do your perio charting and your recession. Okay. In addition to that, if during the 2 hours your anesthesia is wearing off, please come and get your faculty. There's nothing worse than you feeling restricted or inhibited from scaling thoroughly because your patient is maybe, making noise or wincing or things like that. So please make sure that if in the middle of it, your patient's kind of seeming like the anesthesia is wearing off, take the time to re-administer so that your patient is comfortable, for one, and also that you're able to scale thoroughly and completely. Some of the smaller things that we see are students that aren't quite probing to the correct base of the pocket. They're getting hung up on the calculus. So really make sure if you're noticing a 2 millimeter pocket interproximal on the molars, probably not right. Take a look at those types of things. Be realistic about what you're looking at and what the expectation for a similar patient would be. We want to make sure that that at the end you have thoroughly reviewed your patient, you have blown air, you have looked for any areas where there might be a little bit of tissue trauma that maybe soft tissue curettage could kind of correct. So anything little like that, a little piece of a little tag of tissue or something like that, take care of that before you submit your patient, because that can save you some points in the long run. Make sure you keep an eye on the clock. We do like to write down on your desk or your deck paper what time you're starting at, what time you need to be done. So keep an eye on the clock and make sure that you're saving time to kind of get organized and get kind of set up before you officially submit your patient. Blow air, make sure you're using your Cavitron on a higher speed. We should be seeing Cavitrons around 12 to 2 o'clock. You should be using your boost. You shouldn't be using a green tip. We should be seeing really sharp instruments. You're coming in to this as this being one of the most challenging patients that you're going to see. So we shouldn't be seeing, anything that you would be utilizing on a prophy. We want to see good sharp instruments, and really thorough instrumentation as a whole. Okay, please remember that if you show up and you have any, kind of questions, you can definitely ask your faculty. I do encourage you to watch both of these videos before you go in to your CBC. I would watch it the day before so you feel kind of comfortable, and then the day of just so that you feel good, no lingering questions or worries. Again, if you have any questions or concerns, please come up, talk to one of your faculty. We'll be happy to assist you. And most of all, good luck!